Well, it's a habit a lot of folks are guilty of, wearing contacts around the clock, even to bed at night. If you can't remember the last time you took your lenses out, then listen up. The Fox Medical team's Beth Galvin spoke to a local eye surgeon about the worst contact lens mistakes that folks are making. Good morning to you. That just makes my eyes itch to think of 24
it just makes your eyes dry. Yes, and you know, I think the vast majority of eye doctors would tell you not to sleep in your contact lenses, but some people wear them for up to a week at a time without taking them out, and they're so comfortable it's really easy to forget you even have lenses. But the eye surgeon we spoke to says don't. Contact lenses make life so much easier for those of us who are visually challenged. But Dr. Barry Lee, a corneal specialist and eye surgeon with Eye Consultants of Atlanta, says they can also cause some problems.
Probably once a week I'll see a contact lens infection, and the one thing they all have in common is I slept in my contacts.
And that's Dr. Lee's main advice. Take your lenses out before bedtime, even if they're designed for around-the-clock wear.
So there are some that are approved by the FDA for overnight wear. I would say don't sleep in them. I disagree with the FDA on that one. Our biggest risk of infections in the eye are actually people that sleep in their contacts. I tell all patients to just take them out at nighttime, put them in some type of a cleaning solution. If you're really worried about it, you can switch to a daily disposable where you're just putting a new one in every day and you don't have to clean them at all.
Because every day dust, pollen, and dander collect on and underneath our lenses, irritating our eyes. So Dr. Lee says eyelid inflammation or blepharitis is common, and so is a condition known as dry eye.
So there are drops that you can do that help increase tear production. A lot of times you can get just over-the-counter tears. There are prescription medications that can help you produce more tears.
Your contact lenses should fit so well you don't even think about them. And Dr. Lee says if they're moving around or they don't feel right, get them checked by your optometrist or ophthalmologist.
If your eyes are uncomfortable or irritated, I think taking a break is a great idea. And usually after taking that break, they'll reset and feel better.
And Dr. Lee says eye infections, if they're left untreated, can lead to corneal ulcers, and one of those could land you in his office, possibly even facing surgery. Another important safety tip, wash your hands and dry them off thoroughly before you handle your contacts. And Portia, that means before you put them in and before you take them out. You really want to make sure you don't have wet hands handling them.
Right, and then, but there's not just the lenses, the hands, but also the case itself, right?
The case is really problematic, and a lot of people don't change that out as often as they should, which is really like every couple of months you need to throw away that case and get a new one because it gets a biofilm on the inside that's like germs, and it's very stubborn. Even boiling it isn't going to be enough, most doctors think.
Okay, good information. You mentioned sleeping in contacts. What's another big mistake folks are making?
Another big mistake is wearing the lenses for way too long than recommended. So you have the 2-week lenses and you stretch that into a month. That's problematic.
Okay, all right. Consider yourself warned. Wash, wear, and keep it moving.
Yes.
Okay, good news that.
Yeah.
All right, thanks so much. Appreciate that information. A good day.